Hello, I'm Vanetta Harrison. Welcome to CMS You. Each month, we bring you the latest information from the Centers for Medicare and Medicaid Services and helpful tips about health care. The Centers for Medicare and Medicaid Services, or CMS, is a federal agency that administers Medicare and oversees Medicaid, the Children's Health Insurance Program, and the health insurance marketplace. Today, we're happy to have on the show Dr. Chandak Ghosh. We'll be discussing visual impairments. Everyone pay attention. Eyesight is important for all of us. Anyone can be affected by eye problems. Dr. Ghosh, welcome to the show. Tell us about yourself and your specialty.
Sure. As you said, I'm Dr. Chandak Ghosh, and I'm an ophthalmologist in New York City. An ophthalmologist, I'm a medical doctor who specializes in the eye. So I look into your eye, I diagnose and treat eye problems to give you the best vision you can possibly have.
Thank you. Why is taking care of your vision important?
Well, the vision, as we all know, is one of the main ways we relate to the world around us. So that's why the eye is so important. And let me refer here to the eye model, and this will make it clear about how vision is created and what the eye does to make you see well. So this is a model of the eye. This is the outside of the eye, and the lids close, open and close around it. The round part, or the clear dome, is called the cornea. The white part around it is called the sclera. There are muscles on either side that help you look up and down and side to side. There's a thin tissue over the sclera called the conjunctiva, which has vessels. Now I'm going to open up the eye to look inside. And behind that cornea, that clear dome, you have the iris. The iris is the colored part of your eye. So it could be blue, green, brown, depending upon how much pigment you have. And it opens and closes depending upon how much light you have. Behind the iris is the lens. And just like a camera lens, it helps focuses images into your eye. And behind that is the retina, which has blood vessels and leads directly to the brain. So what happens is light comes in, you see something. Let's say you see your guinea pig. And light hits the guinea pig, that light goes through the pupil, into your lens, through and hits your retina in the back. The retina sends it right to the brain, and the brain says, oh, that's my guinea pig. So that's the basic parts of the eye, and all those parts can cause problems, and that's what we look for.
Thank you so much for that. Very enlightening. Sometimes people say they're seeing the eye doctor, but there are also specific terms that people sometimes confuse. What is the difference between ophthalmologist, optometrist, and optician?
It can be confusing, right? There's so many ways to say eye doctor, but we actually do different things. So the op of ophthalmology, optometry, and optician means eye. An ophthalmologist, as I am, again, I'm a medical doctor. We go to medical school, then to internship, residency in eye care, ophthalmology. And then after that, some of us do fellowships. And we look at the eye as an extension of the body. So everything that affects the body affects the eye. And we can diagnose all eye diseases, including the need for glasses. And we can treat you with every tool in our toolbox. And that could be drops, it could be lasers, it could be surgery, it could be pills. An optometrist goes to optometry school after college, and they are the primary care doctors of the eye. They can diagnose and treat early signs of eye disease. If it gets very complicated or needs surgery or laser, they will refer to the ophthalmologist. They also provide glasses and use a different machinery to find out the correct glasses that you have. Mm-hmm. If you go into a glasses shop, you'll often have an optometrist there to help you find the right prescription. And an optician is someone with an opticianry certificate, and that person grinds the glasses and helps fit the glasses onto you. So if you go to an optometry shop or a glasses shop, the person behind the counter is often an optician to make sure you have the right glasses. So we all work together to get you the best vision possible, but we all have different jobs.
Oh, thank you for that. That's very enlightening. When should an individual go to an eye doctor?
People go to an eye doctor for many different reasons, and parents can be glad to know that people are looking at their kids' eyes from the minute they're born, all the way through school. So if you go through the ages, right when a baby's born, a pediatrician will look and make sure the eye structures are there, everything is formed correctly, if the baby can see light or not. As the child gets older, in schools, as well as every time they go to a doctor's visit, they will check vision to make sure the vision is developing correctly. If at any time there's any problem with those tests, they will refer you to an eye doctor. As you get into the teenage years, people start playing sports, and you worry about trauma from baseballs and tennis balls and golf balls and BB guns. You don't want to see an eye doctor. You want to protect your eyes with eyewear to make sure those things don't affect your eye. But of course, if there is trauma, you will go to the eye doctor. Also, teens like to wear contact lenses, and that becomes a problem because you have to make sure you take your contact lens out every night to clean it. So if it's a colored contact lens or a prescription contact lens, you must take it out every night and do not sleep with your contact lenses on. Often there's problems when people sleep with the contact lenses on because it's a nice wet environment for germs to grow, and they come to the eye doctor because they have scratches or infections in their eye. When you get to around 40, you're going to have problems with seeing near, and you'll have to see an eye doctor for probably bifocals or progressives, which are bifocals without the line. Also, if you have a chronic disease like diabetes, high blood pressure, an autoimmune disease like arthritis, sarcoidosis, lupus, those are reasons to go see an eye doctor regularly, at least once a year if you have diabetes, because diabetes can do terrible things to the eye, and unless you go to the eye doctor won't catch it in time. As you get older, you worry about things like glaucoma and age-related macular degeneration, which is a degeneration and scarring of the eye. You want to go in your 50s to start have the eye doctor see if you have any of these possible signs that you might have these things. So an eye doctor shows up many times in your life. Of course, if you ever have itching or pain or sudden loss of vision, I would go see an eye doctor as well to help treat you.
That kind of led into my next question, and you sort of touched on it a bit. The next question was going to be, how often should you see an eye doctor?
Right. It depends upon what the problem is. Most people, once a year is fine. If you have glasses, you want to go check every time your vision changes a little bit. But if you have a chronic disease like diabetes, high blood pressure, or if you're having the beginnings of a cataract in your eye, it's important to go that first time, and depending upon at what stage the disease is affecting your eye, the doctor will tell you to come either frequently or not as frequently. So trust the eye doctor to look in your eye and determine when's the best time to see the doctor next.
Oh, thank you. How do you find a doctor, and do you need a referral?
Sure. The most common way people come to the eye doctor is with a referral from their primary care physician. And the primary care provider knows many eye doctors and knows the eye doctors they trust to see their patients. I think what we see most is people having trouble finding a primary care provider. One place you can go to find a primary care provider is your local community health center. Community health centers see about 26 million people across the country, and they see you without regards to your ability to pay or without regards to your insurance status. So they will see everyone. And they have beautiful facilities. The best way to find one close to you is to go to findahealthcenter.hrsa, which is hrsa.gov. Again, that's findahealthcenter.hrsa.gov. HRSA is the federal agency that helps fund these community health centers around the country.
Oh, thank you so much. What causes visual impairment?
Visual impairment can be caused by many different things. So anything that blocks you from seeing an object is called visual impairment. And let me bring you back to this model again, and I will show you how different stages of the eye or different parts of the eye can cause different problems. So again, the front part is called the cornea, and you can have a scratch in your cornea, which hurts a lot, often caused by contact lenses, or you can have an infection of your cornea with contact lenses if you've slept in them overnight. And the infections actually eat away at your cornea. Sometimes they're in the middle of your cornea, and that can cause visual problems. Now, in between your cornea and your iris, if I took this off, is a fluid, and that fluid can build up in some people, and that's called glaucoma. The fluid doesn't drain as well. And that fluid can cause problems with the optic nerve going back to your brain, and it can sort of slowly kill it off. And glaucoma is a very quiet disease that you don't know it's happening until it's too late, almost like high blood pressure. So it's important to go to the eye doctor, again, in your 50s or so, to have the eye doctor check the pressure. Then the iris can cause problems. You can have cancers and pigment in your iris, or things that grow across your iris that will prevent your eye from the light from getting in. Probably the worst things that happen to the eye are here in the retina. And so you can have diabetes, high blood pressure affect the blood vessels. They can make the blood vessels bleed when they shouldn't bleed. They can also cause the blood vessels to break off and tear off the retina, and that's called a retinal detachment. So that's important. That's why you should go see an eye doctor if you have diabetes, high blood pressure, autoimmune diseases. The retina is the main part that sees in the eye, and when there's damage to that area, that's when the vision is often irreversible. And also age-related macular degeneration, which again is a degeneration of the eye that happens to older people and causes scarring. That also we have treatments for and prevention for, so it's important to go see the eye doctor there.
I'm going to stress, it's very important to see the eye doctor. He mentioned diabetes. He kept mentioning diabetes. I personally know that diabetes can affect the eyes. I have family members that have lost their sight because of the diabetes.
Right.
So for all our listeners, so all our viewers, please, please, please check your eyes, get your eyes checked. What does treatment look like?
Sure. Treatment can be many different things, again, depending upon where the problem is. The most common surgery we do is for cataract surgery. And again, I didn't mention as this cataract here, this is the lens. Again, it's like a camera lens. And as you age or have a chronic disease, this lens can become cloudy. And it's sort of like a window that you paint over. You can't see no matter what you do. So what we do is we do a surgery, which is very common in ophthalmology, where you cut into the eye, we break up the lens into pieces, and we suck out the lens, and we put in another silicone lens, an artificial lens, that is suddenly clear again. That's the most common surgery we do. Other surgeries we do are lasers for the diabetes to stop the bleeding and stop the fluid from coming. Mm-hmm. We have lasers and drops for glaucoma. We also have certain surgeries where we can put little devices in your eye to help the drainage for glaucoma. So lots of surgeries, lots of lasers, and of course drops for infections and glaucoma as well.
We're going to take a brief break here to hear a message from the Centers for Disease Control and Prevention about coronavirus and how to stay healthy.
Hi, I'm Dr. Jay Butler, Deputy Director for Infectious Diseases at CDC. I'd like to talk to you about the new virus that causes the disease COVID-19. Older adults and people who have severe chronic medical conditions like heart, lung, or kidney disease, or diabetes may be at higher risk for severe illness from COVID-19. If you are one of the people at increased risk for serious COVID-19 illness, it's especially important for you to take action to reduce the risk of getting COVID-19 now. The first thing you can do is take care of your own health. Wash your hands often with soap and water for at least 20 seconds. Use an alcohol-based hand sanitizer with at least 60% alcohol if soap and water are not available. Cover your coughs or sneezes with a tissue, or cough or sneeze into your elbow, not your hands. Avoid contact with people who are sick. Clean and disinfect surfaces in your home, such as counters, tabletops, and doorknobs to remove germs. Use household cleaning sprays or wipes according to the label instructions. The next thing you can do is make a plan for what to do if you do get sick. Know who will take care of you if your caregiver gets sick. Talk to your healthcare provider about getting extra necessary medications to have on hand. Get enough supplies too, including enough household items and groceries so you can stay home for a few weeks if you have to. The third thing you can do is pay attention to what's happening locally. If COVID-19 is spreading in your community, stay home as much as possible and avoid crowds. If you get sick with fever, cough, or shortness of breath, call your healthcare provider. If you develop warning signs, such as difficulty breathing, persistent pain or pressure in your chest, confusion, or blueness of the lips or face, these may be signs of serious illness. Call 911. For more information and the latest resources, please visit cdc.gov/COVID-19 or call 1-800-CDC-INFO. That's 1-800-232-4636.
If you are just joining us, I'm Vanetta Harrison from the Centers for Medicare and Medicaid Services. I'm joined today by Dr. Ghosh, an ophthalmologist. We're discussing treatments for visual impairments. Well, what about prevention, and is there anything people can do?
Yes, prevention is very important for many ways. One, again, the eye is an extension of the body. So if you treat the body well, the eye will be well. And that includes eating well, keeping your weight down, eating vegetables. Vegetables are very important not only for your whole body, but for eyesight, particularly green vegetables, spinach, kales, lettuce, etc. That's really what people don't realize, is that the eye acts like your whole body does. In fact, the eye is the only place in the body where I can look into the body and see how the blood vessels are doing. And so all these, the foods you eat affect those blood vessels, so you don't get diabetes, so you don't get hypertension. Other ways to prevent eye problems, especially trauma, is to have eye protection when you're playing sports, when you're drilling, anything that might have small particles that go and hit your eye. That's a way to prevent as well. So all these things to protect your eye. Think about your eye, wear the right types of glasses that the eye doctor tells you, wear the right types of eye protection, and eat well.
Before our next question, I'm going to back up a bit. What about the dryness in your eyes?
Right. Dryness is a very common problem, especially for the elderly and as you get older. Dryness, your cornea here is in the front, and every time you blink, tears come and wash away all the debris. And they also helps lubricate the cornea and keep it nice and clear. As you get older, those tear glands that create the tears begin to shut down and not work as well. And that's when you begin to feel symptoms of dry eye. And that includes feeling pieces of foreign body in your eye. Every time you blink, you feel something in there. So what we do for that, the first thing we do is we give you artificial tears, which are teardrops that you can buy at a grocery store, at a pharmacy store. You put in your eye 3 or 4 times a day. That will help lubricate your eye. There are some people that have worsening symptoms as they get older, or they have chronic diseases. We have other treatments for that, including plugs that go in your eye and prevent your eye tears from draining out, and other stronger drops that could be used to help sort of wake up those tear glands that are shut down.
So that's that gritty feeling that I feel in my eye sometime.
The
whenever
gritty feeling, and use artificial tears. You put a drop in your eye, you close your eye for about a minute, and that will help your eye feel great for the next few hours. 3-4 times a day, and you should be fine for most people. Yeah.
Losing your vision can be scary. What do you say to people who may be going blind?
Yes, and we see many patients that get very scared about losing their vision because, again, it's the main way we communicate with the rest of the world. And we're saying that act as a partner to your eye care provider, because that eye care provider will do everything they can to keep your vision the best it can be. Certainly there are diseases that affect your vision, and not every treatment will work 100% of the time, but we will work and use every possible treatment to keep your vision where it is, sometimes make it a little bit better, but try to prevent it from getting worse. Whether you have diabetes, high blood pressure, cataracts, we all work together in partnership to make sure that the vision stays the best it can be.
So if we have good vision, then the rest of our body should be pretty healthy.
Right.
We start with the vision, keep the vision healthy, and then move forward. You mentioned diet, green vegetables. Some of us don't like green vegetables, but he's saying those green vegetables, the kale. Some of us
Right.
drink the kale smoothie, so all of those green things are good for
They're
the
great
eye.
for your eye. Carrots, as you know, really are great for your eye, but it's about vegetables. It's about, in fact, taking the plate, and the majority of that plate should be vegetables. Those directly affect your eye. They directly affect your body. You can ward off diabetes, hypertension, many chronic diseases by eating those vegetables.
You hear legally blind and other terms used. What does this mean?
Sure, legally blind is not a medical term, it's a legal term. And what it means is the central part of your vision is gone. So the central part is the part that helps you see color. It's the part that helps you see small details and things. If that's gone for any reason, whether it be trauma or bleeding from your blood vessels, scarring, that's called legally blind. And there are many legal venues you can go through to help you if you are legally blind.
I know I hear people say he's legally blind, but then that person is seeing things he can see. I'm like, well, you just cleared that up. You said it's a legal term, not necessarily.
Right, and you can still see things. It's just not as clearly as those of us who have our central vision.
Oh, okay. Once you've lost your sight, do you need to see the eye doctor?
Yes. Well, when we say lost your sight can mean many different things. So lost your sight can mean completely cannot see anything. It can mean you see light, but not much else. You can see movement, that's another level of losing your sight. Or you can see that big E sort of on the eye chart. So there's different levels of seeing and losing your sight. So at every level, the eye doctor is an important partner to help you prevent you from getting worse. That's one thing. Also, if you completely lose your vision, other things can happen, especially pain in your eye can show up in the future. So the eye doctor is there to watch you constantly to make sure all the factors that may cause pain are minimized. So again, it's very important to continue going to the eye doctor, and the eye doctor will tell you how often you need to see him or her.
Oh, thank you. Can you tell us more about macular degeneration? I think you spoke on that earlier, but give us a little bit more information.
Sure. Macular degeneration is the #1 cause of blindness in the elderly population. In the non-elderly population, it's diabetes causing eye vision problems. But in the elderly population, it is macular degeneration. And what happens is the central part of the eye, the macula, begins to degenerate and scar over. Blood vessels grow where they should not grow, and you lose that central vision. Again, it can be prevented by eating green vegetables. We also, if you have it, we can give you injections into the eye or lasers into the eye to help make it get better. Again, it's not foolproof. Not every treatment will help, but the best way to deal with it is to prevent it. When you're in your 50s, you should go to the doctor to make sure you don't have it or don't have the beginnings of it. The doctor will put you on a vitamin treatment first if you're seeing signs of it, to help prevent it from getting worse. But again, those green vegetables play a role here as well. Eat those green vegetables, prevent age-related macular degeneration.
We're going to be winding our show up pretty soon, but I have one more question here. Where can people go if they are visually impaired and need assistance like social services?
Sure. Again, as vision is a way you communicate with the world, people tend to shut down when they lose their vision, and they don't want to be social again, and they don't know how to work with the world that they were used to when they could see. There are many great institutions that work with people that can't see, specifically Lighthouse for the Blind Guild, as well as the Helen Keller Services in New York City, help people who are visually impaired navigate the world by training them, giving them instruments, giving them telephones with large numbers, so they can be part of the world just as they were before they lost their vision. So they're great social service organizations to help people. So the message should be, don't close yourself up and be scared of the world. The world is there to help you navigate it, even if you can't see much.
Thank you so much.
Thank you.
Thank you, Dr. Ghosh, for joining me today to talk about how important it is for people to take care of their visual needs. If you are looking for more information about visual impairments, the Centers for Disease Control and Prevention has a website on their Vision Health Initiative. Go to cdc.gov/vision health. I'd like to remind our viewers of the important phone numbers and websites they can use to get more information about the programs for the Centers for Medicare and Medicaid Services, or CMS. If you want more information on Medicare, visit medicare.gov or call 1-800-MEDICARE. That's 1-800-633-4227. To get more information about your state's health insurance marketplace, call 800-318-2596. You can also visit healthcare.gov and select your state. To get more information about Medicaid and the Children's Health Insurance Program, also called CHIP, visit medicaid.gov. You can learn how to apply for Medicaid or CHIP coverage in your state. For all these programs, no matter what language you speak, help is available for you in your own language. We love to hear from you, our viewers. If you have an idea for a show topic, please email us at tbshow@cms.hhs.gov. This may be my last time hosting the show before I retire. So thank you for having me in your homes over the years. I look forward to being a fan of the show, just like all of you. I'm Vanetta Harrison. On behalf of us at CMS, thanks for watching. Until next time, be well.